All right, so let's take a look at homeostatic imbalances. So first off, we're going to look at injuries. So a sprain is where the ligaments reinforcing a joint are stretched or torn. Now sprains heal slowly, and that's because the ligaments are poorly vascularized. So we're seeing quite a major strain right here. All right. Next are cartilage injuries. So here, if we overstress a joint, like our knee, we can tear the meniscus. And one of the problems with tearing the meniscus is made of fiber cartilage, and that fiber cartilage is avascular, lacks blood vessels. So it doesn't get enough nourishment to repair itself. And what this can create is it can create loose bodies. And these are pieces that are just moving throughout the knee area. All right, they're torn off pieces of cartilage. And so they can impair joint function. And so if you have a really bad meniscus tear, you're going to have surgery to remove those loose bodies. This also makes the joint less stable. Now the thing is, if you tear your meniscus, it doesn't always mean that you have to have surgery. If it's a really bad tear, you might need it then. All right, next is a dislocation, also known as a luxation. This is where the bones are forced out of alignment. This is accompanied by sprains and inflammation and typically leads to joint immobilization. The bones must be returned to their proper positions. The problem with this is that an initial dislocation stretches the joint capsule. By stretching the joint capsule, this can lead to repeat occurrences. So if somebody dislocates their shoulder, they have a tendency for that to occur again. All right, let's take a look at inflammatory and degenerative conditions. All right, and I'll have a picture of this, just more sprains here. First let's look at a bursitis. That's an inflammation of the bursa. This is due to a blow or friction. Like water on the knee is actually an inflamed bursa on your knee. Tendinitis is an inflammation of the tendon sheaths. And this is usually from overuse. So you can get tendinitis from doing a repetitive motion that you don't typically do. Lastly is arthritis, and this is an inflammation of the joints. And there are over 100 different types of arthritis. We're going to look at 3 of those. The first is osteoarthritis. And this is the most common chronic arthritis. It is a degenerative condition, meaning it's not going to improve. This is typically known as wear and tear arthritis. So, you've twisted an ankle several times, and so now you have osteoarthritis in that joint. It is not disabling, all right? You'll have to deal with the pain, though, all right? So what happens here is normal joint activity breaks down a little bit of articular cartilage, but in healthy individuals that's replaced. But if you constantly, are exposing it to wear, like, in an injury, you're going to get some exposed, thickened bones, and these are going to form bony spurs called osteophytes. And these are going to enlarge the bone ends, and that's going to restrict movement. And you're going to have some pain associated with that. The next type of arthritis is called rheumatoid arthritis. This usually arises between the ages of 40 and 50. It's much more likely in women, 3 times more likely in women than it is in men. It does cause disability, and it's usually bilateral. So if you're having some issue in your right wrist, you're also going to get it in your left wrist. So even though I did that backwards. It has flare-ups and remissions, which is typical of an autoimmune disease. So an autoimmune disease is a disorder in which your body's immune system attacks your own tissues. So what happens here is it starts off with inflammation of the synovial membranes. And so inflammatory cells are going to move to that area, white blood cells. Those white blood cells then, for some reason, attack the area, and that causes a further increase in inflammation. And that's going to cause a thickening of the synovial membranes. And so by causing a thickening of the synovial membranes, that's going to cause more friction in the joint, which then erodes the articular cartilage of the joint. All right? Scar tissue will form, and that will connect the bone ends to each other. So the bone ends, one bone is connected to another bone by scar tissue. What's going to happen next, though, is that scar tissue is going to ossify. It becomes bone. And so the ends of the bones now are connected with bones, and that immobilizes the joint. And this poor lady here has some really bad rheumatoid arthritis. You can see here, these are the metacarpals, these are the phalanges. Those are supposed to be going straight, not at that angle that you see. So you can see, I mean, that pinky is way off of that joint. This poor lady is in a lot of pain here. Next is gouty arthritis, also known as gout. This is caused by a buildup of uric acid in the blood that is deposited as crystals in the joints. It is more common in men than it is in women. If untreated, gouty arthritis can also cause the bones to fuse together.